So I think we've got a chance now to move to listen to Joe Garr, who's one of our pharmacists working in Ellesmere Port. So he's going to say a few words about the vaccine itself, its side effects and how effective it is. And then again, Katie will field any questions we've had in on that area and any concerns that people may have there. So thank you, Joe.
Okay, so I'm just going to quickly talk about the side effects and efficacy of the vaccine. So the Medicines Health Regulatory Authority, I'm going to call them the MHRA, they're basically the ones responsible for checking if a vaccine is safe and able. All medicines, not just vaccines, so they check every medicine you get in the UK will be checked out by them first. So the process is the same for every medicine. It's the same, also same process is used for vaccines. So they get checked pretty rigorously, so, to be fair. So there's checks in each stage of development before then they do clinical trials, and then it's then rolled out to the general population after that, once they're pretty sure it's safe. So the common side effects with the vaccine, okay, you might get a painful arm, you might feel a bit tired, just generally lethargic, bit of a headache, aches and pains, flu-like symptoms. And on this note, I wanted to quickly refer to, there's been a lot in the news lately about the AstraZeneca or Oxford vaccine and the side effects which might be related or might not be related to that. So it's been a lot in the news about the blood clots associated or which may have been associated with it. I wanted to quickly clarify it. Basically, the MHRA have said there's no evidence. So the MHRA have basically come out and said very clearly that there's no increase in the number of cases of blood clots that you would normally see. So there's been no increase according to the MHRA. And it's not just the MHRA. So the World Health Organization have come out, and the European Medicines Agency have also come out again today, say that there is no increased risk of blood clots with this vaccine. And I wanted to quickly mention, okay, so with COVID, okay, you're going to get more blood clots if you've got COVID. So if you prevent it, it just makes sense to do. And then you've also got, like, for example, you get increased risk of blood clots of all sorts of things. But for example, the contraceptive pill, you might get increased risk with that. But you get increased risk if you're pregnant as well. So it's about getting the balance right, and the benefits clearly outweigh the risks with this vaccine. Okay, so the MHRA recommended that if you have severe allergies to any of the ingredients, that you shouldn't receive the vaccine, but that would basically will be checked before you got the vaccine. And the first dose, you get 2 doses. The reason you get the first dose is it gives good protection, and then you get the second dose to prevent even further any problems further down the line, so it gives you longer protection. And it's important to bear in mind that getting the vaccine doesn't necessarily stop you transmitting the virus. So if you get the vaccine, you still follow the guidance, still wear the mask for now, and still stay 2 meters away if you're working in close environments. Any questions?
Excellent. Thank you, Joe. That's really helpful. And thank you for talking up front about the concerns that people are having around the AstraZeneca vaccine. We know that is a concern out there. So thank you. So if we turn to Katie for questions, I may bring a couple of the panel in around that if we get further questions. So thank you.
Yeah, we've had quite a few questions actually. So the first asks, what are the most common side effects of the COVID vaccination?
Okay, so you probably you'll get a bit of a dead arm, so maybe feel a little bit tired, just general aches and pains, but they wouldn't last longer than a week. It'd probably last a couple of days and then settle down. So they're the most common ones. Just take paracetamol.
Thank you. So there's another question that asks around the side effects of the vaccine. So do they cause any long-term health conditions or implications?
It's a good question. Well, basically, to be brutally honest, with the vaccine, it's considered a black triangle drug, which lots of medicines are considered black triangle drugs, which basically means that it's a relatively new medicine. no one can say what's going to happen 10 years down the line, but we can say right now that getting the vaccine will help greatly reduce the risk of contracting the coronavirus, and may save not just possibly yourself becoming seriously unwell, may save maybe a family relative who might be a little bit more vulnerable than yourself becoming seriously unwell. So it's a benefit and risk kind of thing. No one can say what's going to be like in 10 years' time because no one really knows. But you can say right now that if you get the vaccine, you're going to reduce the chance of becoming unwell right now with the virus, and greatly reduce and greatly ease the burden. And we all want to come out of lockdown. We all want to get back to normal life. No one wants to wear a mask forever. So it's just about doing what we can do right now for the long-term goals of trying to get back to normal again.
Thank you. Linked to side effects again, I've heard, so the question asks, I've heard that there are different side effects depending on which vaccine you have. Can I choose which vaccine I have?
I would say on this, I'd encourage people to just get whatever one is available at that time. That's what I would say. That's honest advice I would give, just to get the one which is available at that time. I might have to defer to my colleagues who might know more about whether they can choose, but I'd encourage people to just get the one which is offered.
So I'm going to offer Emily, who's wonderfully put her hand up, to come in on that. Thanks, Emily.
Thank you. No, I think this is so I'm so passionate about saying this message out there. No one vaccine is better than the other, and no one vaccine has more side effects than the other. And so really there is a chance that you will get this dead arm, painful arm, as Joe has described, and you might get some transient flu-like symptoms for a couple of days. That's it. And if you think that's bad, COVID is bad. So really, the side effects from the vaccine pale into insignificance when we think about how poorly you feel if you catch COVID-19. So I just want to say that there is no one, and actually you can't, because as being part of rolling out a vaccine programme, I can say that it's absolutely dependent on whatever delivery of the vaccine. We're getting Pfizer vaccine one week, and then we'll get AstraZeneca the next week, and then Pfizer. And even sometimes we'll have the two vaccines being given in one clinic as well. We'll do Pfizer at the beginning of the clinic, and then we might use AstraZeneca a bit at the end. You can't choose. So when you walk into these clinics, you're not, as a patient, going to be able to say, actually, I want this one rather than that one. There might be a clinical reason why we might suggest AstraZeneca over Pfizer, and that's purely around a very, very rare type of allergy called anaphylaxis, but there is no other reason. And so I think really no one vaccine is better than another, and we're not the way that we're rolling out these vaccines means that patients cannot choose one or the other.
Thanks, Emily. And I think just to support what Emily's saying, so having been to Ellesmere Port, and I've seen the way that the vaccine centre operates there, and I've seen them literally stop the line, if you like, at midday and swap from one vaccine to the other. And I've seen the very careful way that people are talked to understand if people have got any allergies and what the decision might be based on that. Jeevan, did you have your hand up as well there?
Yes, I was just going to continue on what Emily was saying. The fact that we've been working with two vaccines simultaneously, often on the same day, and not having a difference in the side effect profile that patients have been feeding back to us is clear evidence in terms of numbers that there is no significant concern that one vaccine's side effects are any worse or any better than the others.
Thank you, Jeevan. Thank you. Katie, thanks.
This has generated lots of questions. So another question that we have here is around the type of vaccine, but also about how to get the vaccine. So the question asks, if you've had a first dose through your GP, can you have your second dose through a mass vac centre? And do you have to have the same vaccine type for the second dose, or can you mix?
Well, I can answer the second part of the question, then I'll have to pass it on to my colleagues. I'd say Obviously, you can't chop and change the vaccines at the moment. It has to be the same one. Like started off with the Pfizer for the first dose, you'll get the Pfizer for the second one. And whether you can get it at your GP and then go to a mass vaccination centre, I'd say probably can, but I want to double check with people who know more than me.
So Emily or Jeevan, does someone want to take that one?
Yes.
You go ahead, Jeevan. Okay. Go ahead.
Yes, I think we had this debate a number of times with while preparing for the second part of the vaccine, and unfortunately, the guidance still is to for the first the team who did the first vaccine to take on the responsibility of giving the second vaccine, unless the circumstances are exceptional. For example, if the person's moved to another place, we wouldn't want to sort of drag them back, or if they've been vaccinated in the hospital and now at home. Certainly we have to take those into considerations, but as far as possible, the guidelines still say that the first vaccinator is responsible for the second, as far as I'm aware, until now. But things change almost on an everyday basis, as we know, in terms of the recommendations and guidelines. So.
Thank you. That's my understanding as well, Jeevan, that it's the responsibility, and obviously if you will be, and Emily's described the supply process, we will just be getting into, I think it's Neston and Williston, won't we, and Helsby and Frodsham, that they will be starting their second vaccines very, very soon. So the people that they vaccinated the first time round will be coming back for their second doses. So that's the supply and the stock that will be coming into the GP practices and the other places that are doing the vaccine. So thank you. Good. Thank you very much. Katie.
Thank you. It's more of a reflection from somebody that's joined us that we might want to comment on, that says, firstly, I was not sure about taking the vaccine. Now I've decided to have it, but they are concerned about the adverse effects and the fact that they could make them poorly and they need to work as their family depends on it.
Well, frankly, it's not going to be worse than the coronavirus, so that could basically make you really unwell. So there's benefits and risks of medicines, but the benefits outweigh the risks, and it's worthwhile taking. It's worthwhile I would encourage you to get the vaccine done.
So, thank you. That's really helpful, Jo. I wonder if Emily or Jeevan in particular, what sort of side effects are you seeing? Sort of how I've seen a couple of my colleagues, my GP colleagues actually, have been quite poorly with it, perhaps for a day, and then have come back fine. What sort of side effects are you seeing? I mean, you've done sort of hundreds and thousands of vaccines probably between you. What sort of side effects are you seeing?
Emily, did you? Yeah.
I mean, it's very, very transient. So you will get, there have definitely patients who've experienced very brief flu-like illness. They feel shivery, they feel tired, they have to put themselves to bed for a night, but then they feel fine the next day. And I think, as Jo said, if and particularly this questioner, if you're telling us that actually, you know what, I need to get up and go to work the next day, because actually I need to earn money and I don't get sick pay and what have you, and actually if you caught coronavirus, then you would be in an even more difficult situation, and please, the side effects are very, very mild. I know I took paracetamol on the second day after my vaccine as well, but I was fine. I still got up and went to work, and I just felt tired and a bit achy. We're certainly not getting an influx of calls into GP surgeries because the symptoms are so mild and transient.
That's helpful. And Jo, I wondered, as a pharmacist, are you getting people coming in after the vaccine, after sort of advice and support for you as well? Have you seen any of that?
Well, I work predominantly in a GP surgery at the moment, so I don't unfortunately get to see them as regularly as I did when I was in a community pharmacy. But I think from what I've heard, generally people have been fine with it. It's a bit of a dead arm, but it's nothing too serious.
Okay, thank you. Really helpful, all of you. Thank you. Ian, I feel like I'm leaving you out. Anything you wanted to... Oh, he does. Look at that. Brilliant. Thank you, Ian.
That's okay. I suppose it was just a good opportunity to build. I mean, just to reinforce what my colleagues have just said there, that if it obviously is a mild feeling the next day, but there is support out there if you have got, if you do need require wider support, and that's obviously if you've had to self-isolate as well prior to getting the vaccination, and so you can get that through if you go to the Cheshire West and Chester Council web pages, there's lots on there about support hubs and self-isolation packs and financial support as well, if because it is extremely challenging circumstances economically as well. So please look at the pages. We also have a joint website called Live Well, which ourselves and the NHS have on there. Lots of activities and support on there, especially around mental health and wellbeing as well. So just an opportunity to share that, really.
Thank you, Ian. That's really helpful. Thank you. Katie, anything else on this one before we move on to the next topic? Still going?
There's still plenty Brilliant. Of questions, but I'm conscious that we have another topic. This is something that Ian said that he might be happy to talk about, as Joe's already mentioned it. There's been some additional questions around blood clots have been reported in Europe. Has this been reported in the UK too? And somebody specifically asking if they can request the Pfizer vaccine rather than the AstraZeneca because they have concerns over the safety and potential blood clots from the vaccine.
Okay, who wants to take that one, Emily or Jeevan? I'm going to suggest as first off on that one. Jeevan?
Yeah. Yes, I think yes. There's been a lot on the media within the last week about this, and it is certainly concerning and worrying for people to understand. UK is probably the has got most vaccinated population right now, and MHRA says that there is no evidence that there is an increased number of blood clots or identified in patients who've had vaccines any more than what we would expect in the general population who haven't been vaccinated. So that's probably the most robust guidance we have. Other countries have suspended their vaccination while they find out whether there is a link or not. So that goes to say that there is still uncertainty within the doubts that they have about the link of blood clots to vaccination. So we would, what we can reassure everyone is that the Medicines and Health Products Regulatory Authority, which is MHRA, wouldn't take any risks with any of our patients' lives or health when it comes to any condition. So I think we can stay reassured.
Thank you. Anyone else wants to add to that? No. Okay. We're hearing your concerns, and I think that hopefully we're answering as much as we can. And the MRHA guidance has been really clear. We can obviously publish that as part of our frequently asked questions, the actual advice that's coming out. And I know there has been some numbers, hasn't there, published by AstraZeneca that actually indicates how many cases. We're talking just a handful of cases across Europe, from what I can remember. I don't know if any of the panel have got those to hand. If not, we can put that out after the meeting, can't we? Just to add context to the inquiries that are going on in other European countries. But thank you, Katie. Any more questions from you on this topic at this point?
Not at this point, no.
Thank you.